you can't go to a doctor if you don't have insurance. So without insurance, if I have to wait till I'm so sick till I say, well, I'm going to go to the emergency room. Hopefully they'll give me something. And then what do you do when it doesn't get better? Then you got to run back to the emergency room.
Years ago, in the midst of bailouts and closings, some of the true victims of the economic crisis were families here in our community. When you earn too much to qualify for any assistance, but still can't afford insurance, where do you turn? When you are unemployed, but don't have access to medical care, what do you do? For many, it would mean a visit to the local emergency room. For others, they just quietly suffered. In 2008, thanks to the vision and generosity of caring healthcare professionals, the Palmetto Volunteers in Medicine made a commitment to stand in the gap for those who had nowhere to turn.
I visited that clinic and I was very impressed. I came away with the feeling that one day I wanted to be a part of that sort of thing.
Hartwell and Bill and Pat and I began to meet weekly to talk about how to start this clinic.
Today, known as the York County Free Clinic, dedication to the community they serve means that close to 2,000 residents receive quality, compassionate care.
It's a right that people have, that everybody has access to quality care.
The clinic really focused on those folks who had fallen through the cracks and who did not have access to health care.
It was the first time that many of them ever felt like they had a doctor or a doctor's office that was theirs.
Modeled after the Volunteers of Medicine Clinic in Hilton Head, the staff and volunteers of the York County Free Clinic embrace the culture of caring, which was the cornerstone in the founding of the organization.
You can just tell when you walk in the door, when you're greeted by people, there's no presumption there. There's no haughtiness or anything. Everybody's very humble.
They know my first name is Ellen. They come up and hug me and how you doing? It's not all about business and politics and everything. It's being a person, and we all family.
Our culture of caring is based on an ethical standard in medicine that ensures how patients are treated during a clinic visit is just as important as the actual medical care they receive. We believe that treating our patients with compassion and dignity is an integral part of their healing process.
I had to humble myself and really go in and see the strength in asking for help and being given help, and what that does for other people too, and how I'm sure it fulfills them in a great way to help other people.
Our patients, who range in ages from 18 to 64, all deserve quality health care. Around 54% of our patients live below the federal poverty guidelines, which means a family of 4 is living off of less than $25,000 per year. If we did not exist, more than half of our patients admit they would have no choice but to seek care at emergency rooms. When you consider that 32% of our patients suffer from COPD, 51% from diabetes, and 74% from hypertension, without our services and access to care, their lives could be at risk.
Well, I have COPD, and it's hard to get the medicine. One medicine costs you about $500, and I take 3, and different other things so that I can breathe. They give me the best opportunity to have the best life that I can with my situation, and they do it all free.
In addition to providing primary care and chronic disease management, our volunteer doctors and nurses provide other free services, including lab work, prescriptions, pap smears, mammograms, eye exams, and access to specialists. We also offer coaching and education about nutrition and fitness to help them improve their overall health. In fact, in 2017 alone, through the combined efforts of 120 active volunteers, we provided 6,616 patient visits through 5,842 hours of services. Because of the generosity of more than 300 donors, who contributed funds to provide services valued at more than $2 million. We continued to fulfill our commitment to the culture of caring.
I can't do a lot for anybody, but I want somebody else to do a lot for somebody. And if they go away, I'll go away. And we need them. We need them a lot.
Together, through caring staff, volunteers, and supporters, we can create a healthier York County.